Modern cancer treatments, they're pretty miraculous, right? With things like radiotherapy, we're seeing more people survive than ever before. But that amazing success story has a hidden chapter, one that sometimes starts years after the fight is supposedly won. And that's the big question, isn't it? What happens after? For a lot of survivors, life gets back to normal. But for some, a totally new and unexpected battle is just getting started, long after they've been given the all clear. To really get this, we've got to start with the people at the very center of it all, the survivors themselves. I mean, they've already beaten cancer. But for some, the fight, it isn't quite over. Okay, so imagine this. Years after you've successfully finished radiotherapy for a pelvic cancer, you start to feel this pain or a weakness, maybe numbness in your legs. The research calls it a chronic, progressive, and often irreversible complication. It's like a shadow that shows up long after the storm has passed. So there's a medical name for this: radiation-induced lumbosacral radiculopathy, or RILP. Basically, it's nerve damage, and it's caused by the very treatment that saved a person's life. This can have a massive impact on their quality of life, on their independence. So the really crucial question is, why? Why does this happen? Well, to answer that why, a team of researchers basically became medical detectives. They launched a full-on investigation to connect the dots between the radiation treatment and this awful side effect. The main goal of their study was to figure out if there was a direct link between the dose of radiation a patient got and whether they developed this nerve damage. And to do that, they went through the cases of 175 patients, all of whom were totally in remission from pelvic cancers. And this wasn't just a quick look either. They dug into patient data from a 6-year period, and the median follow-up time was almost 7 years. That long-term view is just so important, because as we're learning, this condition can take years and years to even show up. All right, so this is where it gets really, really interesting. After they crunched all that data, a super clear pattern started to pop out. So here's the first big finding. 13% of the survivors in this study developed symptoms of RILP. Now you might think, okay, 13% doesn't sound like a ton, but for those people, the impact was huge. We're talking moderate to severe functional disability. So what did that 13% have in common? Well, the researchers found their smoking gun. It turns out, as they say right here in the paper, higher radiation doses to the nerve network in the lower back were directly and significantly linked to the nerve damage. And wow, the numbers on this slide just make it crystal clear. Patients who ended up with nerve damage got a median max dose of 72.1 gray. By the way, gray is just the unit for measuring the radiation dose. Now compare that to patients who had no symptoms. They got a much lower median dose of 60.2 gray. That is a massive difference in a really powerful clue. This chart here shows the exact same thing, just in a different way. It's looking at what percentage of the nerve area was inside the high-dose radiation zone. And look, for patients with symptoms, over half of that nerve area, more than 54%, got hit. For patients without symptoms, just about 18%. The takeaway is simple. The more nerve tissue you expose to high radiation, the higher the risk. But it turns out the dose wasn't the whole story. The investigation also revealed that some patients were just more likely to have this problem than others, even when the doses were pretty similar. Yep, the researchers found 3 other key risk factors. It was more common in female patients, people who already had diabetes were at a higher risk, and finally, getting chemotherapy at the same time as radiation also seemed to up the chances of developing nerve damage. So with all this evidence in hand, the story takes a turn, right? It goes from being an investigation to being about prevention. Because this research doesn't just point out a problem, it actually points us straight to a solution. So to get the solution, we first need to know what exactly we're trying to protect. And it's this, the lumbosacral plexus, or LSP. Think of it as this super complex bundle of nerves deep in your pelvis. It's what controls the feeling and movement in your legs, and it's this structure that was getting damaged by accident. And all of that leads us to this incredibly clear, actionable plan. The researchers are basically saying, hey, from now on, when you're planning a treatment, step 1, carefully map out the lumbosacral plexus. Step 2, Officially call it an organ at risk, just like you do for the bladder or the spine. And step 3, actively plan the radiation to keep the dose to these nerves as low as you possibly can. It's a game changer. And this really gets to the heart of it all. This isn't just about avoiding a side effect. It's about a bigger shift in how we think about cancer care. It forces us to ask, how do we make sure that a longer life is also a better life? Research like this helps patients and doctors talk not just about surviving, but about the quality of that survival for years and years. Because true success isn't just beating cancer, it's thriving after it. The incredible research we've been talking about was published in the journal Curious by Dr. Zeinab Dabi and her colleagues. Their work has given us a vital blueprint for making a life-saving treatment that much safer and for improving the quality of life for so many cancer survivors to come.